Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted worlds of nursing. Hi there, student nurses. I'm Criselmer Ducanes, clinical instructor, teaching fundamentals of nursing practice. Today, we will be talking about sleep. Sleep is a basic human need. It is a universal biologic process common to all people. Humans spend about 1/3 of their lives asleep. We require sleep for many reasons: to cope with daily stresses, to prevent fatigue, to conserve energy, to restore the mind and body, and to enjoy life more fully. Sleep also enhances daytime functioning and is vital for cognitive, physiological, and psychosocial function. Sleep has come to be considered as an altered state of consciousness in which the individual's perception of and reaction to the environment are decreased. Sleep is characterized by minimal physical activity, variable levels of consciousness, changes in the body's physical processes, and decreased responsiveness to external stimuli. Now let's discuss about reticular activating system, or the RAS. It is a complex bundle of nerves in the brain that is responsible for regulating wakefulness and sleep-wake transitions. An intact cerebral cortex and reticular formation are necessary for the regulation of sleep and waking states. Now let's discuss about biologic rhythms. Biologic rhythms exist in plants, animals, and humans. In humans, these are controlled from within the body and synchronized with environmental factors such as light and darkness. And the most familiar biologic rhythm is the circadian rhythm. So what is circadian rhythm? It is a natural, internal process that regulates the sleep-wake cycle and repeats on each rotation of the Earth roughly every 24 hours. Although sleep and waking cycles are the best known of the circadian rhythms, body temperature, blood pressure, and many other physiological functions also follow a circadian pattern. Sleep is a complex biologic rhythm. When a person's biologic clock coincides with the sleep-wake cycles, the person is said to be in harmony, and that is, the person is awake when the body temperature is highest, and asleep when the body temperature is lowest. Circadian regularity begins to develop by the 6th week of life, and by 3 to 6 months, most infants have regular sleep-wake cycle. Now let's proceed to the types of sleep. The two types of sleep are NREM, or the non-rapid eye movement sleep, and the REM, the rapid eye movement sleep. During sleep, the NREM and the REM sleep alternate in cycles. To best understand this, we should know the sleep architecture. Sleep architecture refers to the basic organization of normal sleep. Changes in the architecture of one's sleep can be linked to physiological and psychosocial changes. Now let's proceed to the first type of sleep, which is your NREM sleep. It occurs when activity in the RAS is inhibited. About 75% to 80% of sleep during a night is NREM sleep. NREM sleep was previously divided into 4 stages. Now, it is divided into 3 stages. Each of the stages is associated with distinct brain activity and physiology. For stage 1, it is the stage of very light sleep and lasts only a few minutes. During this stage, the person feels drowsy and relaxed. The eyes roll from side to side and the heart and respiratory rates drop slightly. The sleeper can be readily awakened and may deny that he or she was sleeping. Low voltage brain waves are noted in stage 1. In stage 2, it is the stage of sleep during which body processes can continue to slow down. The eyes are generally still, the heart and respiratory rates decrease slightly, and the body temperature falls. An individual in stage 2 requires more intense stimuli than in stage 1 to awaken, such as touching or shaking. In stage 3, it is the deepest stage of sleep, differing only in the percentage of delta waves recorded during a 30-second period. During deep sleep or delta sleep, the sleeper's heart and respiratory rates drop 20% to 30% below those exhibited during waking hours. The sleeper is difficult to arouse. The person is not disturbed by sensory stimuli. The skeletal muscles are very relaxed, reflexes are diminished, and snoring is most likely to occur. This stage is essential for restoring energy and releasing important growth hormone. Now let's proceed to the second type of sleep, which is REM sleep. It usually recurs about every 90 minutes and lasts 5 to 30 minutes. Most dreams take place but usually not remembered unless the person arouses briefly at the end of the REM period. This type of sleep is also called paradoxical sleep because the EEG activity resembles that of wakefulness. Distinctive eye movement occurs, voluntary muscle tone is dramatically decreased, and deep tendon reflexes are absent. In this phase, the sleeper may be difficult to arouse or may wake spontaneously. Gastric secretions increase, and heart and respiratory rates often are irregular. It is thought that the regions of the brain that are used in learning, thinking, and organizing information are stimulated during REM sleep. Now let's discuss about sleep cycles. People typically undergo NREM and REM sleep. The complete cycle usually lasting about 90 to 110 minutes in adults. The duration of NREM stages and REM sleep varies throughout the sleep period. During the early part of the night, the deep sleep periods are longer. As the night progresses, the sleeper spends less time in stage 3 of NREM sleep. REM sleep increases and dreams tend to lengthen. Before sleep ends, periods of near wakefulness occur, and stage 1 and 2 NREM and REM sleep dominate. Now let's proceed to functions of sleep. The effects of sleep on the body are not completely understood. Sleep exerts physiological effect on both nervous system and other body structures. Sleep in some way restores normal levels of activity and normal balance among parts of the nervous system. Sleep is also necessary for protein synthesis, which allows repair processes to occur. The role of sleep in psychological well-being is best noticed by the deterioration in mental functioning related to sleep loss. Individuals with inadequate amounts of sleep tends to become emotionally irritable, have poor concentration, and experience difficulty making decisions. For the normal sleep patterns and requirements, although it is used to believe that maintaining a regular sleep or wake rhythm is more important than the number of hours actually slept, recent research has shown that sleep deprivation is associated with significant cognitive and health problems. Although re-establishing the sleep or wake rhythm is important, it is appropriate to allow and encourage daytime napping in hospitalized clients. For newborns, it is recommended that they should have 12 to 18 hours a day on an irregular schedule with periods of 1 to 2 hours spent awake. So basically, the newborns should have 12 to 18 hours a day of sleep. For infants, however, at the end of the first year, an infant usually takes 2 naps per day and should get about 9 to 12 hours of sleep in 24 hours. For toddlers, 12 to 14 hours of sleep are recommended for this age group. For preschooler, they are required to have at least 11 to 13 hours of sleep per night, particularly if the child is in preschool. For the school-age children, they need 10 to 11 hours of sleep per night, but most receive less because of increased demands such as homework, sports, and social activities. They may also be spending more time at the computer and watching televisions. For adolescents, they are required to have 9 to 10 hours of sleep each night. However, few actually get that much sleep. Teens are sleepy at times and places where they should be fully awake, at school, at home, and on the road. For adults, most healthy adults get 7 to 8 hours of sleep per night. However, individuals' needs do vary. Some adults may be able to function well without sleepiness or drowsiness with 6 hours of sleep, and others may need 10 hours to function optimally. Lastly, for older adults, a hallmark change with age is a tendency towards earlier bedtime and wake times. Older adults, 65 to 75 years old, usually awaken 1.3 hours earlier and go to bed approximately 1 hour earlier than younger adults. Older adults may show an increase in disturbed sleep that can create a negative impact on their quality of life, mood, and alertness. Now let's discuss about sleep quality and sleep quantity. Both the quality and the quantity of sleep are affected by a number of factors. Sleep quality is a subjective characteristic and is often determined by whether a person wakes up feeling energetic or not. The quantity of sleep is the total time the individual sleeps. Now let's proceed to the factors affecting sleep. First is illness. Illness that causes pain or physical distress, such as arthritis, back pain, can result in sleep problems. People who are ill require more sleep than normal, and the normal rhythm of sleep and wakefulness is often disturbed. People deprived of REM sleep subsequently spend more time rather than the normal in this stage. Next factor is environment. Environment can promote or hinder sleep. The person must be able to achieve a state of relaxation prior to entering a period of sleep. Any change, for example, noise in the environment, can inhibit sleep. Next is lifestyle. Following an irregular morning and nighttime schedule can affect sleep. Moderate exercise in the morning or early afternoon usually is conducive to sleep, but exercise late in the day can delay sleep. The person's ability to relax before retiring is an important factor affecting the ability to fall asleep. It is best, therefore, to avoid doing homework or office work before or after getting into the bed. Next is emotional stress. Stress is considered by most sleep experts to be the one of the greatest causes of difficulties in falling asleep or staying asleep. Another one is stimulants and alcohol. Caffeine-containing beverages act as stimulants of the central nervous system. Drinking beverages containing caffeine in the afternoon or evening may interfere with sleep. People who drink an excessive amount of alcohol often find their sleep disturbed. Alcohol disrupts REM sleep, although it may hasten the onset of sleep while making up for lost REM sleep after some of the effects of the alcohol have worn off. People often experience nightmares. The alcohol-tolerant person may be unable to sleep well and become irritable as a result. Next is diet. Weight gain has been associated with reduced total sleep time, as well as broken sleep and earlier awakening. Weight loss, on the other hand, seems to be associated with an increase in total sleep time and less broken sleep. We also have smoking. Nicotine has a stimulating effect on the body, and smokers often have more difficulty falling asleep than non-smokers. Smokers are usually easily aroused and often describe themselves as light sleepers. Next is motivation. Motivation can increase alertness in some situations. A tired person can probably stay alert while attending an interesting concert or surfing the web late at night. Motivation alone, however, is usually not sufficient to overcome the normal circadian drive to sleep during the night. Nor is motivation sufficient to overcome sleepiness due to insufficient sleep. A combination of boredom and lack of sleep can contribute to feeling tired. Next is medication. Some medications affect the quality of sleep. Most hypnotics can interfere with deep sleep and suppress REM sleep. Now let's talk about the common sleep disorders. A knowledge of common sleep disorders can help nurses assess the sleep complaints of their clients and, when appropriate, make a referral to a specialist in sleep disorders medicine. First is insomnia. Then we have excessive daytime sleepiness. Then we have parasomnias. What is insomnia? Insomnia is described as the inability to fall asleep or remain asleep. Individuals with insomnia do not awaken feeling rested. Insomnia is further classified into two. First is the acute insomnia. It lasts 1 to several nights and is often caused by personal stressors or worry. The other one is chronic insomnia. It persists longer than a month. Now let's proceed to the behavioral treatments for insomnia. Treatments for insomnia frequently requires the client to develop new behavior patterns that induce sleep and maintain it. Examples of behavioral treatments are: first is stimulus control. It is where you create a sleep environment that promotes sleep. Second is cognitive therapy, learning to develop positive thoughts and beliefs about sleep. Third, we have your sleep restriction, following a program that limits time in bed in order to get asleep and stay asleep throughout the night. Next, we have excessive daytime sleepiness. Client may experience excessive daytime sleepiness as a result of hypersomnia, narcolepsy, sleep apnea, and insufficient sleep. Hypersomnia. It refers to a condition where the affected individual obtains sufficient sleep at night but still cannot stay awake during the day. Hypersomnia can be caused by medical conditions, for example, CNS damage and certain kidney, liver, or metabolic disorders such as diabetic acidosis and hypothyroidism. Rarely does hypersomnia have a psychological origin. Next is narcolepsy. It is a disorder of excessive daytime sleepiness caused by the lack of the chemical hypocretin in the area of the CNS that regulates sleeps. Hypocretin, also known as orexin, is a neuropeptide hormone that regulates arousal, wakefulness, and appetite. Next, we have your sleep apnea. It is characterized by frequent short breathing pauses during sleep. Although all individuals have occasional periods of apnea during sleep, more than 5 apneic episodes or 5 breathing pauses longer than 10 seconds per hour is considered abnormal and should be evaluated by a sleep medicine specialist. Symptoms suggestive of sleep apnea include loud snoring, frequent nocturnal awakening, excessive daytime sleepiness, difficulties falling asleep at night, morning headaches, memory and cognitive problems, and irritability. Although sleep apnea is most frequently diagnosed in men and postmenopausal women, it may occur during childhood. There are 3 common types of sleep apnea. First, we have obstructive sleep apnea. It occurs when the structures of the pharynx or oral cavity block the flow of air. The other one is central apnea. It involves a defect in the respiratory center of the brain. All actions involved in breathing, such as chest movement and airflow, cease. The other one is mixed apnea, combination of central and obstructive apnea. So here is an example of your normal and patients with sleep apnea. For normal, as you can see, there is a patent airway. However, in the sleep apnea, the airway is being blocked by your tongue. So that causes a problem to your patient. Treatment for sleep apnea is directed at the cause of the apnea. For example, enlarged tonsils may be removed. Other surgical procedures, including laser removal of excess tissue in the pharynx, reduce or eliminate snoring, may be effective in relieving the apnea. In other cases, the use of a nasal continuous positive airway pressure (CPAP) device at night is effective in maintaining an open airway. Weight loss, however, may also help decrease severity of the symptoms. Sleep apnea profoundly affects a person's work or school performance. In addition, prolonged sleep apnea can cause a sharp rise in blood pressure and may lead to cardiac arrest. Over time, apneic episodes can cause cardiac arrhythmias, pulmonary hypertension, and subsequent left-sided heart failure. Next, we have insufficient sleep. Healthy individuals who obtain less sleep than they need will experience sleepiness and fatigue during the daytime hours. Depending on the severity and chronicity of this voluntary, unintentional sleep deprivation, individuals may develop attention and concentration deficit, reduced vigilance, distractibility, reduced motivation, fatigue, malaise, and occasional diplopia and dry mouth. Now let's discuss about parasomnias. These are a group of sleep disorders that involve unwanted events or experiences that occur while you are falling asleep, sleeping, or waking up. It may include abnormal movements, behaviors, emotions, perceptions, or dreams. And it is classified into 3 classes. We have non-rapid eye movement, rapid eye movement, and miscellaneous with no specific stage of sleep. Let's discuss parasomnias with non-rapid eye movement. It is associated with confusion upon arousal, sleep tremors, and sleepwalking. Next, parasomnias with rapid eye movement. It is associated with arousal disorders such as sleep paralysis, and it may be a nightmare disorder with exaggerated features of REM. Lastly, we have your miscellaneous parasomnias. These are not associated with any stage of sleep and may produce nocturnal enuresis or hallucinations, often related to medicine, substance abuse, or a medical disorder. Here are some of the examples of parasomnias. First, we have your bruxism. It is usually occurring during stage 2 NREM sleep. This clenching, grinding of the teeth can eventually erode dental crowns, cause teeth to come loose, and lead to deterioration of the temporomandibular joint. Next is enuresis. Bedwetting during sleep can occur in children over 3 years old. More males than females are affected. It often occurs 1 to 2 hours after falling asleep when rousing from NREM stage 3. Next is periodic limb movement disorder. In this disorder, the legs jerk twice or 3 times per minute during sleep. It is most common among older adults. This kicking motion can wake the children and result in poor sleep. Next, we have sleep talking. Talking during sleep occurs during NREM sleep before REM sleep. It rarely presents a problem to the person unless it becomes troublesome to others. Lastly, we have sleepwalking. It is also known as somnambulism. It occurs during stage 3 of NREM sleep. It is episodic and usually occurs 1 to 2 hours after falling asleep. Sleepwalkers tend not to notice dangers, for example stairs, and often need to be protected from injury. Now let's proceed to the assessment. A complete assessment of a client's sleep difficulty includes a sleep history, health history, physical exam, and if warranted, a sleep diary and diagnostic studies. All nurses, however, can take a brief sleep history and educate their clients about normal sleep. For sleep history, a brief sleep history, which is usually part of the comprehensive nursing history, should be obtained for all clients entering a healthcare facility. It should, however, be deferred or omitted if the client is critically ill. Next is health history. A health history is obtained to rule out medical or psychiatric causes of the client's difficulty of sleeping. It is important to note that the presence of medical or psychiatric illnesses such as depression, Parkinson's disease, Alzheimer's disease, or arthritis should not preclude the possibility that a second problem, which is obstructive sleep apnea, may be contributing to the difficulty sleeping. Next is physical exam. Rarely are sleep abnormalities noted during physical examination unless the client has obstructive sleep apnea or some other health problems. Common findings among clients with sleep apnea include an enlarged and reddened uvula and soft palate, enlarged tonsils and adenoids in children, and obesity in adults, and in male clients, a neck size greater than 17.5 inches. Occasionally, a deviated septum may be noted, but it is rarely the cause of obstructive sleep apnea. Next is sleep diary. A sleep specialist may ask clients to keep a sleep diary or log for 1 to 2 weeks in order to get a more complete picture of their sleep complaints. Next is diagnostic studies. Sleep is measured objectively in a sleep disorder laboratory by polysomnography. So let's discuss about polysomnography. It is also called a sleep study, and it is a comprehensive test used to diagnose sleep disorders. And it records brain waves, the oxygen level in your blood, heart rate, and breathing, as well as eye and leg movements. Sleep pattern disturbances may also be stated as the etiology of another diagnosis, in which case the nursing interventions are directed towards the sleep disturbance itself. So here is some of the example of the nursing diagnosis related to sleep. First is risk for injury related to somnambulism. Second, ineffective coping related to insufficient quality and quantity of sleep. Third is fatigue related to insufficient sleep. Fourth is impaired gas exchange related to sleep apnea. Fifth, we have deficient knowledge related to misinformation. Sixth, anxiety related to sleep apnea and or the diagnosis of sleep disorder. And lastly, we have activity intolerance related to sleep deprivation or excessive daytime sleepiness. Now let's proceed to the goals of care. The major goal is to maintain or develop a sleeping pattern that provides sufficient energy for daily activities. Other goals may relate to enhancing the client's feeling of well-being or improving the quality and quantity of the client's sleep. The nurse plans specific nursing interventions to reach the goal based on the etiology of each nursing diagnosis. These interventions may include reducing environmental distractions, promoting bedtime rituals, providing comfort measures, scheduling nursing care to provide for uninterrupted sleep periods, and teaching stress reduction, relaxation techniques, or good sleep hygiene. Now let's discuss about sleep hygiene. Sleep hygiene refers to interventions used to promote sleep. So this involves measures such as health teaching about sleep habit. Healthy individuals need to learn the importance of sleep in maintaining active and productive lifestyles. They need to learn the conditions that promote sleep and those that interfere with sleep. Sleep, safe use of sleep medications, effects of other prescribed medications on sleep, effects of their disease states on sleep, and importance of long periods of uninterrupted sleep. Supporting bedtime rituals. Most people are accustomed to bedtime rituals or pre-sleep routines that are conducive to comfort and relaxation. Altering or eliminating such routines can affect a client's sleep. Common pre-bedtime activities of adults include listening to music, reading, taking a soothing bath, and praying. Children need to be socialized into a pre-sleep routine such as a bedtime story, holding into a favorite toy or blanket, and kissing everyone goodnight. Sleep is also usually preceded by hygienic measures such as washing the face and hands or bathing, brushing the teeth, and voiding. Next is creating a restful environment. All people need a sleeping environment with minimal noise, a comfortable room temperature, appropriate ventilation, and appropriate lighting. Although most people prefer a darkened environment, a low light source may produce comfort for children or those in a strange environment. Infants and children need a quiet room usually separate from the parent's room, a light or warm blanket as appropriate, and a location away from open windows or drafts. To create a restful environment, the nurse needs to reduce environmental distractions, reduce sleep interruptions, ensure a safe environment, and provide a room temperature that is satisfactory to the client. The environment must also be safe so that the client can relax. People who are unaccustomed to narrow hospital beds may feel more secure with side rails. So you have to place the beds in low positions, use night lights, and place call bells within easy reach. Next is promoting comfort and relaxation. Comfort measures are essential to help the client fall asleep and stay asleep, especially if the effects of the person's illness interfere with sleep. Next is enhancing sleep with medications. Sleep medications often prescribed on a PRN or as-needed basis for clients include the sedative hypnotics, which induce sleep, and anti-anxiety drugs or tranquilizers, which decrease anxiety and tension. When PRN sleep medications are ordered in a clinical setting, the nurse is responsible for making decisions with the client about when to administer them. These medications should be administered only with complete knowledge of their actions and effects and only when indicated. I believe that is the end of my discussion and lecture on sleep. So I hope you learned something today. So thank you so much for listening.